Hi everybody, it's Elle, and this video is for the partners of mom. So whoever that might be, maybe it's boyfriend, maybe it's husband, maybe it's just dad, maybe it's mom, other mom, maybe it's girlfriend, maybe it's wife, maybe it's any of the people, maybe it's non-gender conforming individual, doesn't matter. Whoever is there as mom's partner, this video is for you. So, as you know, at Happy Birthday, we are very concerned with mom's mental health and making sure that her birth is a great experience that she can, think on and influence her relationship with her baby and her life going forward. But did you know that your mental health and your ability to be present for mom is super important for that to happen? And it's important for you too, because this is also your baby experience. This is your birth experience as well. And, it's important that you have good mental health for your own fulfillment. So let's go ahead and talk about that. The first thing is that you need occupational balance. Okay, so what is occupational balance? Occupational balance is doing all of those things in life that are important. Okay, so like, for example, ADLs, we call them ADLs, activities of daily living. That's taking care of your body. Then we have instrumental activities of daily living, IADLs, and that's taking care of the home, the chores, all of the things, cooking, cleaning. Then we have work, and we have education, and we have sleep and rest, and we have leisure, and we have social participation, and we have play, and we have health management. All of those things are important for you. You need a little bit of everything in a balanced way so that you can be mentally healthy and be present for mom. So when mom's pregnant and when mom has baby for the first maybe 4 or 5 months, it's going to be tricky. Your balance is going to have to shift a little bit. So it's important you get a little bit of everything, but you might have to cut back in one area and make up in another. So maybe, you need to do more chores around the home. You need to cook, you need to clean more. And so rather than having 3 days a week where you're playing basketball with friends, maybe it's one day a week. Okay. Things like that. That's important. But now that we have that out of the way, let's talk about the actual birth. The actual birth can be very scary for dads because we do live in the modern era with wonderful techniques and medicine, and moms have a great chance of having a healthy birth, labor, delivery, all of it. But we also do have mothers who, do pass away, unfortunately. It's rare, but it is the highest rate in the United States out of all of the developed world, which is something that we need to address. So I understand that dads might be very worried. And dads can actually develop PTSD after a birth as well. Postpartum PTSD isn't a specific diagnosis. PTSD is, but then we also know it can happen in postpartum period. So in a way, dads, you can develop postpartum PTSD too in your own way, right? So when this can happen, it can be something like wife or partner has a traumatic birthing experience, such as an emergency C-section, maybe the crash cart was called for mom and or baby, and you're sitting there and you feel helpless. You are scared that you're going to lose your partner, you're scared you're going to lose baby, and you feel helpless to do anything other than stand there. That's pretty scary. Okay. And I don't want to minimize that. Maybe you belong to a minority population and the rates of mistrust with healthcare and also with, maternal mortality rates is high with minorities. So maybe you have even more stress because you come from a minority population. Those are all valid things to be experiencing. So I just want you to know right now that it's not a lack of manlyhood or manliness, right? That it's totally normal and it makes sense and it's valid. Okay. And I also want to say the worst thing that we can do is ignore that and just hope it goes away because things like that don't just go away. So how do we address it? Well, first let's think. Have you ever had PTSD before? Diagnosed or maybe even not? So, for example, I have a family member who went, to Iraq, and this family member developed PTSD. And that made this person more likely when their partner had a baby that they would then re experience PTSD. that they would develop it again. Okay. And if you had a history of that, or a history of abuse, a history of loss, if you have a lot of anxiety about the birth, that makes you more likely to develop PTSD yourself. So, what can we do to prevent PTSD? Well, again, occupational balance is important. Stress management is important, because post-traumatic stress disorder, so stress, right? Managing stress, that's a huge part of PTSD. And then also some of the same techniques that we use with mom, as far as playing a visuospatial cognitive activity within 15 or within 6 hours of the trauma, and doing that for 15 minutes with the sound off. So that can be playing Tetris. So visuospatial cognitive activity sounds super fancy, but that can be playing Tetris or Candy Crush, again, with the sound off. And you could also maybe try something like a word search if you don't have access to electronics, picture find, things along that nature. Those things can actually help prevent those short-term traumatic memories from turning into long-term traumatic memories. And it's not something that would keep you from remembering the birth. It would just dampen down the trauma, okay? And I have other videos about that. You can go ahead and check those out. So that's the first thing, okay? And then also continuing that balance that we talked about during, the postpartum, or excuse me, the prenatal period. So continuing that on to the postpartum period, making sure you have that balance, making sure you get those things that you need. Stress reduction. I also talk about stress reduction in other videos, but I will just cover that briefly with you, Dad. So knowing your body, how you experience stress. For me, my shoulders go up to my ears. I'm like this when I'm stressed. And then like clenching the jaw, like, ugh. And then like my stomach muscles tighten, and I feel anxious. My heart rate is going. I have shallow breathing. And I recognize those cues in my body. It's very important we recognize those cues, because when they arise, then we recognize, okay, I need to do something. I need to address this before it gets out of control. So, one of my favorite ways to tell people to deal with this is simple breathing techniques. So, going into a quiet environment, away from the stress as much as is possible, and breathing. Take 5 minutes, even 2 minutes if you only have 2 minutes, and you're just going to breathe. Okay. Going to breathe in through the nose. 2, 3, 4, hold it. 2, 3, 4, and then breathe out. 5, 6, 7, 8, 9, 10. And you're breathing out through your mouth. So it's kind of this circular breathing, in through the nose, out through the mouth. Okay. And it's also longer out than in. And you want to do this for a couple of minutes at least. I would say 2 to 5 minutes. And what I love to do with parents is you put the blood pressure cuff on before breathing, and then you do the breathing, and then you do the blood pressure cuff again, and it's always lower. Blood pressure always goes down. Your pain is going to go down, your stress is going to go down. And what's so important with that is it prevents that cortisol. So that's the hormone that your body releases when you're stressed, and that's the hormone that gets you ready, preps you for fight or flight, fight, flight, freeze, right? Those are the three most commonly known. There's a couple more that are also involved. But in any case, so Dad, you need to do that because you want to prevent that cortisol from building up. Because once it gets to this threshold, like it builds, 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 and once it's so high, it's going to take 30 minutes for that cortisol, that stress hormone, to leave your body. Okay. And so it's easier to do it as soon as possible rather than later. Now, if you do find yourself hitting that threshold where you're so super stressed that you just can't even handle things, remove yourself from the situation. If you're tending baby, that's the time when you call one of those trusted family members, friends, neighbor, whoever you trust, to just come sit with baby for 30 minutes, and you go for a walk. Go for a walk. And we know that green plants help reduce pain and stress. We know that sunlight helps reduce pain and stress. We know that the act of walking helps reduce stress. So all three of those things can really help you. If it's super hot outside or it's not safe where you are, go for a drive or do what you need to do to remove yourself from that environment. Okay, that's the most important thing. And I would say start with breathing, and then just kind of clear your mind because it's physiological. You have that stress hormone in your body, And that stress hormone makes you more likely to fight, flight, or freeze. So, fighting, that can be verbally fighting. For some people, that could be physically fighting, which can be so dangerous for mom and so dangerous for baby. We don't want that, right? It can be fleeing the situation. A lot of times dads leave after baby's born and or partner, and we think, oh, just deadbeat parent, right? And there's more to it than just that. And part of PTSD, for example, can be avoiding. So those things that remind you of the trauma, it could be mom, it could be baby, it could be hospital, it could be doctor's appointments, it could be any of those things. So if you find yourself avoiding those, it's not necessarily that you're just this horrible person. It may be that you have PTSD. If you do develop PTSD. So those things that we had that can try and help prevent it, such as stress management, like the breathing, yoga, meditation, mindfulness, that the visuospatial cognitive activity, right? So the Tetris or the Candy Crush within 6 hours of the trauma, any of those things. If we find that they are not quite cutting it and you're noticing some changes in your personality, you're like having nightmares about the birth, or you're feeling hyper vigilant, like you don't sleep at night because you're watching the baby, or you're concerned the baby is not feeding enough. So, even after breastfeeding, you're giving baby bottle after bottle after bottle, things like that. That can be a sign of postpartum PTSD or PTSD, right? So that's something that you want to recognize early on, and you want to go in for treatment. And we know that psychologists have wonderful treatments that they can do with you. Wonderful. They have made so many advancements. And I also have resources on my website with free apps that the military has created that are wonderful that can help you. But I do want to like emphasize, go in, um, go into your physician and let them know what's going on. They can send you to a psychiatrist who can provide you medications if you need it. And sometimes physicians might feel comfortable, your primary care provider might feel comfortable giving you medications. It just depends. You can also just like make an appointment with behavioral health, which is going to be like clinical social workers, or it's going to be psychologists, and they can work with you. You just let them know, hey, I've been having these symptoms and I'm afraid that I have PTSD. And then they can help assess and they can help treat. And we know that they have made so many advancements that they can help you. So there's really no need to leave, right? To run out, because ultimately that is going to be something that is always going to haunt you. Okay. So just take care of your own mental health. Make sure that you're looking after yourself as well as mom and baby. And then be there for mom and baby too after you've looked after your mental health, right? Incorporate it all through balance, because dads, you matter too. And I just want to point out that you're not alone. There has been research done on this, and it happens, and it's something that we don't talk about. We're not talking about dads and the trauma of moms giving birth and how that can impact dads. So you're not alone. It's a thing. All right, guys, I hope that helps, and best of luck to you. Congratulations. Bye.